Thank you so very much for that kind introduction, and thank you to all of you for joining us tonight. My name is Sally Hudson, and I've been serving Charlottesville and Albemarle County in the House of Delegates for the last 4 years, and I am running for our brand new State Senate District 11 out here in the Blue Ridge. I am the first woman to serve Charlottesville in the Virginia House, the first woman to hold Thomas Jefferson's seat in the Virginia House, and I teach at his university, which didn't admit women until 1971. The early 1970s were an extraordinary time for Virginia women, for American women more broadly, for a whole host of reasons, not the least of which was the landmark Roe versus Wade decision that we were supposed to celebrate the 50th anniversary of this spring. This was the first year that state legislators in Richmond felt the full weight of our responsibility for reproductive rights on our shoulders, because the Supreme Court has made very clear that they are no longer coming to our rescue. And I am running for the state Senate because I think Virginia women are ready to fight for our rights on our own terms. I have learned in my first 4 years of public service, as Ms. Miller just said, that we do sometimes have to do that work ourselves, that we cannot always count on our male colleagues to do it for us. I learned that lesson as a freshman delegate when I filed a bill to repeal Virginia's ban on health insurance coverage for abortion care, because I knew that even when we were protecting people's reproductive rights on paper, that there were a whole lot of people who couldn't actually afford to get the health care that they need when they need it, because we had legal barriers to people using the health insurance they'd been paying for themselves to get the support that they needed with a diagnosis that they never expected. And I've faced a lot of opposition to that, including from men in our own party who were not ready to talk about who pays for abortion. Now, I am an economist, as some of you may know, so I'm always ready to talk about who pays for what, but especially when it comes to healthcare, because it doesn't really matter what your rights say on paper if you can't afford the care that you need when you need it. I teach economics at the University of Virginia, and on occasion on the floor of the House of Delegates when duty calls. I am the only economist in the General Assembly, and my work is laser focused on the financial barriers facing Virginia families. When COVID hit and 1 in 6 Virginia workers lost their jobs, I worked hard to secure an extra $220 million in debt relief for people who had been caught in unemployment traps. I have passed bills to protect Virginia patients from predatory medical debt collectors, from the burden of court fines and fees, to encourage more investment in affordable housing in Charlottesville City, which, just like Arlington and a whole lot of places in Virginia, is facing an affordable housing crisis. I think it's very important that in one of the wealthiest places in the country, that we are doing everything we can to make sure that every Virginia family can not just make ends meet, but have the resources that they need to chase their dreams and to ensure that their family thrives. And so that's the work that gets me up out of bed every day. We have a brand new state Senate seat out here in the Blue Ridge. It's all of Charlottesville, it's all of Albemarle, it's all of Nelson and Amherst too. And this is one of the deepest blue seats on the state Senate map. And it has got to have a strong progressive champion who is willing to stick their neck out loud and proud for the ideals that we hold so dear. And that's why I'm running for the state Senate this year. I think there's a lot that we can do to shake up the Senate. I think in particular about the Senate Commerce Committee, where so many of the big deal financial problems that we face run their bills. Right now, that committee has 15 members and only 1 woman. And I don't think that we should be surprised that when there's 1 woman in the room, when it comes time to talk about commerce and the workforce, that we don't have paid family leave yet in Virginia. I don't think it's surprising when there's only 1 woman in the room when it comes time to talk about commerce and the workforce, that we're one of the lowest states for teacher pay in the country. And we don't yet have nurses unions at Virginia's top hospitals. There is an awful lot of work that we can do to empower workers all across Virginia to get the treatment that they deserve on the job. That is the work that I would love to do more of in the state Senate. Real quick, I saw a handful of questions in the chat, in particular one that is about ranked choice voting, because that has been a deep passion project of mine since before I've been in office. And in 2020, I passed a bill that now empowers communities across Virginia to use ranked choice voting at the local level. I think it's one of the most concrete things that we can do to get more diverse voices into politics and to start to get our country back on track. And that's why I'm so grateful to the good people of Arlington, who have become the first community to take us up on the opportunity to run a ranked choice election. They will be nominating their candidates for county board in June with ranked choice, and we're working hard here in Charlottesville to follow them. And so that is a real big step that we're going to be taking. And in the state Senate, I would love to continue to carry ranked choice legislation so that we can expand that opportunity up and down the ballot so that we can get more voices, more choices, more power to voters in all of our elections. So with that, I am so grateful to all of you for taking some time this evening to talk with us about these races.